welcome to Kool Conversations, yet another one coming your way. I'm Dianne Thomas, and we're observing Heart Month. So this time around, we're going to be speaking with a specialist. We have with us consultant cardiologist at the Heart Foundation of Jamaica, Dr. Rohan Wilks. Now, we're addressing this topic to raise awareness of cardiovascular health, and we're empowering individuals to take charge of their well-being. We're seeing far too many people dying from heart disease. What can we do? Well, from Kool's standpoint, we're going to help you to realize what you're doing wrong and what you should be doing so that we improve your well-being. In Jamaica, heart disease remains one of the leading causes of death, making it crucial to educate the public on prevention, early detection, and treatment. So, you know the Heart Foundation of Jamaica, household name. It's a leading organization in the fight against heart disease in this our beloved nation. So we welcome you to Kool 97 FM. Hi, Dr. Wilks, how are you?
Hi, I'm good, thank you. Thanks to you and the team for having me.
It's our absolute pleasure. So we're going to get into the meat of the matter, and we're going to find out from you. Now, Heart Month is a critical time for advocacy, even as we're aware that Heart Month is not going to be enough time to cover heart disease. But let's try and get through some key points as we put this on social media so it's accessible by all. So it's a time for advocacy. What would you say is the current state of heart health in Jamaica?
Well, I would say the current state of heart health is bad. As you rightly said in your introduction, cardiovascular disease, of which heart disease is a big part of, is the #1 cause of mortality in Jamaica, in our region, and globally. So it's a huge problem. And what adds to that is that more and more we're seeing younger people with heart disease, people in their productive years, who actually pass away from their heart disease. And even those who survive have to live with significant disability, which prevents them from, seeing their true potential and functioning in the way that they're supposed to function as members of society. So it's a huge issue.
Heart disease used to be associated with older ages. So what is causing us to now see younger individuals coming to hospitals and health centers with heart problems?
Well, there are a number of factors. I think some of the key factors that we know is that in more recent times, there's a lot of physical inactivity. Our lives have become more sedentary. More of us are driving. Less of us are out in the field farming. We have office jobs. And inactivity has been seen as a big risk factor for cardiac disease. That coupled with changes in our diet, more westernized diet, more fast food, which is what is usually available to people, is being consumed, and that contributes a lot. So because of that, we're having a lot more childhood obesity that translates into adulthood disease with hypertension, diabetes, that leads to heart disease.
Can heart disease be broken down into, say, this is heart disease here, and there are branches to it? And what are those common branches that perhaps the layperson is familiar with?
Yeah, that's a good question, because a lot of times when we talk about heart disease, we're talking about atherosclerotic heart disease.
There's a big word for you.
So what that basically means is when there's plaque buildup in the arteries. This is what happens as we get older, and it kind of accelerates when we have hypertension, diabetes, and obesity, and when we smoke. So when we have plaque forming in the arteries to the heart, plaque forming in the arteries to the brain, that's what leads to heart attack and stroke. So that's a big part of heart disease. But there are also less common aspects of heart disease. There can be abnormal heart rhythms, and we can have valvular problems related to the heart, and then we can have problems directly related to the heart muscle. So you can kind of break down heart disease into those different components.
So Dr. Wilks, so we start out with heart disease, but then you're also mentioning some other non-communicable diseases. Make the link. Because you tell me that I have diabetes, then in the same breath you're cautioning me about heart disease? How? How do we move from that level to this level where we're looking at surgery?
Right. So that's a great point. So it's very important to recognize the link between the non-communicable diseases, as you say, namely hypertension, diabetes, and also abnormal cholesterol or dyslipidemia. Because these are the factors that lead to the plaque buildup in the arteries. As you have hypertension, you can imagine that high pressure against your blood vessel, damaging the lining of your blood vessel, that contributes to plaque buildup. Diabetes with high levels of glucose and insulin in the system also damages the wall of the arteries, and same goes for cholesterol, because a big part of the plaque that builds up on the wall of the arteries is made of cholesterol. So when you have all of those factors coming together, coupled with smoking, inactivity, and obesity, that's what contributes to plaque buildup in the arteries in our body that leads to heart disease as well as stroke. So it's important to identify these things, diagnose them, and address them early. That's a big strategy in preventing heart disease.
But really, is it inescapable? Because when you look at it, no, let's just be honest. We all like that little piece of cake.
Right.
We all love that fried food.
Right.
Culturally, it is sometimes even more than just culturally. Could be historic. Because when you think that we're coming from a slavery background, for the most part, sugar cane was what was accessible. We developed that taste for sugar. We developed that taste for salt. The salted meats, the salted beef, and whatever else that slaves used to get. So that is literally passed down to us, so whether or not we recognize it. So based on that historical and also the cultural aspect of it, can we really avoid getting cardiovascular disease?
Yes, we can avoid it.
Is it realistic?
It is realistic. We can certainly do things to, at the very least, reduce the risk. I don't think we're going to totally eliminate cardiovascular disease, but we can definitely do some things to reduce the risk of cardiovascular disease. And a lot of it is cultural, as you said. As you mentioned that I had the recent experience of talking to one of my patients who has diabetes, and he has bad coronary artery disease. Luckily, he has been doing well on medication and everything, and he started to lose weight, which was one of his goals. But people around him were telling him he looks sick and why is he losing so much weight? So that's a big part of our culture. We like to see people with meat on their bones. Yeah, right. So there's a big cultural mindset we have to overcome.
Yes.
So we have to be mindful of the choices we make in terms of being physically active, in terms of the foods we eat. And it's difficult, like you said, the unhealthy foods are what are more accessible. But when we think about the consequence, we have to use that as a driving force to make healthier choices, eat more fruits and vegetables, fresh meats, not fried. Baked meats are more healthy than the fried foods, less oil, less sugar sweetened beverages, cut out the cigarette smoking and moderate alcohol use are some of the strategies to employ.
You mentioned cutting out the oils. Not all oils are equal.
I would agree with that.
Which ones are the healthier choices?
So the whole oil story, it's a bit controversial. I think it's well accepted that olive oil tends to be more healthy. Coconut oil, which is very commonly used in our setting, is controversial because it has been shown to increase the bad cholesterol, but it hasn't really been shown to increase the risk of heart disease. So it's a little controversial. So I usually give a little cautious note to patients with that. But certainly the other seed oils and vegetable oil we should avoid or use very minimally.
Okay. Well, even with olive oil, you shouldn't be using that in
not
abundance.
Too much, yeah.
So what are some of the warning signs? And another thing I want to touch on, cardiovascular disease, can it be hereditary as well?
Yes, definitely can be hereditary. So we find that if you have a first degree relative, meaning a brother or sister or a mother or father who developed cardiovascular disease relatively early, so that's a man less than 50, a woman less than 60, that puts you at significantly increased risk of developing it as well. So if you have a first degree relative with heart disease, you have to be extra careful to put things in place to avoid it.
Wow. Okay, so some of the warning signs, let's look at those, because strokes, we're going to get into that.
Right.
Because is it that strokes tend to precede cardiovascular disease, full-blown cardiovascular disease? Like they have a track record that they've had minor strokes and then boom.
Well, I would say not necessarily, because you can start out with a large stroke, which is why, you know, prevention is better than cure. So as it relates to stroke, you know, when you present with a stroke, patients can have weakness to one side of the body, so the arm and the upper limb, and weakness to the face where the face is twisted, and that usually manifests as slurred speech. They might be confused suddenly. So those are some of the more common signs of a stroke. And certainly if anybody experiences those symptoms, they should get to the nearest hospital as soon as possible.
This is something that we have to tackle head on, because the reality is it is one of the major concerns health-wise, because it's not just affecting households. It's not affecting just my household, your household. This has an impact on the nation's budget, because when you think of it, when you go to the hospital, and remember hospitals are helping to subsidize, we have like Drug Serve, where they're buying your medication. Let's see how best we can take control of our health to drive down those bills for personal households, but also for the nation. So it's bigger than just you and me. All right. So the heart attack. We know that individuals have to undergo surgery because there is those who have the bypass. Exactly what is the bypass surgery about? You have how many layers of bypass surgery?
Well, okay, let's take it back a little bit. So when, you know, we spoke about plaque buildup in the arteries, so now this relates to plaque buildup in the arteries to the heart, or the so-called coronary arteries. So when someone has a heart attack,
yes,
you know, based on the extent of the heart attack, you know, the patient may have to do what we call an angiogram, which is a special procedure where tubes are passed up to the heart, injecting dye into the artery so we can identify what part of the artery is blocked. And at that time, you can actually insert a balloon to open up the artery to save the heart muscle, which is being starved of oxygen at the time. However, there are some situations where we might find that people have multiple blocked arteries, where inserting a balloon and a stent won't adequately solve the problem, and those are the patients that may need to go on to have coronary artery bypass, where we actually take blood vessels from other parts of the body, sew it to...
Sorry, like where?
We
just want to know where it's going to be left deficient.
No, these are arteries that have, these are parts of the body that have multiple supplies of blood. So there's an internal mammary artery in the chest that can be removed, the radial artery in the wrist, and sometimes the big vein on the leg called the saphenous vein is taken out. So we know that people can function without these blood vessels, so they can be used to save this critical organ called the heart.
Now, the theme for Heart Month often emphasizes prevention. What practical steps, because you've already mentioned some, that Jamaicans can take daily to reduce the risk of heart disease, especially those with limited resources? Because that's just the reality of it all.
Yeah, and that's what makes it difficult. So, I mean, we can't say enough about diet. Again, sugar-sweetened beverages. It's a big thing that the Heart Foundation has been speaking out about. And I should also mention the campaign about front of package labeling, because reading labels, I don't think is something in our culture, to look at what exactly is in our food so we can make the right choices. So as little processed food as possible, more whole, fresh food is what is more healthy. We mentioned the importance of enough fruits and vegetables in the diet, and avoiding too many carbohydrates, especially simple carbohydrates like refined sugar, rice, and flour.
Oh, that's going to be bad news for a lot of our listeners.
No fried dumpling.
You can't do this all at once. You're going to remove all of the good stuff.
But more complex carbs like sweet potato and our yam tend to be more healthy.
Okay, sweet potato versus Irish potato. Which one's better?
Sweet potato has been shown to have a lower what we call glycemic index, meaning the sugar spike we get to it tends to be lower than Irish potato, so I'd say sweet potato.
Okay, now it's common now on our streets to see vendors with these little fruit bowls, or they have little bags of fruits.
Yes.
And it's a quick grab and go.
Right.
You're in the traffic and you see them, you hail them and you get your fruits. And you think that you're doing well because you are consuming your fruits.
Yes.
But the combination of fruits, the sugar, when you have in the bag the orange plus the banana plus the slice of watermelon, you know that each of those fruits I've listed has quite a lot of sugar on its own.
Right. Yes.
What would be your recommendation for fruit intake?
So fruit intake, actually generally the bag of fruits I think is a good thing. Where it can be bad is somebody who has diabetes, who already has a problem with metabolizing sugar, then it can be a problem. But generally, 3 or 4 pieces of fruit is actually a good thing. So I think it's good that that's available more than, a patty or a donut. Yeah, so I think the fruits is a good thing, generally speaking. But we're best suited consuming our sugars in the actual fruit than in the actual juice. Because when you have juice, you can imagine how the way it's quickly absorbed tends to spike our blood sugars quicker or higher than when we consume and take our time and chew our fruit.
Okay.
Yeah, so that's important to remember. The way we consume our food is important.
We're seeing rising rates of hypertension and obesity in young people.
Right.
What initiatives are the Heart Foundation of Jamaica implementing to ensure that even as this might be the case, they don't go into later life and they're the ones who are developing diabetes, hypertension, etc., that lead to cardiovascular disease?
Right. Well, I'm not central to the preventative arm of Heart Foundation, but I can say, you mentioned the front of package labeling. That's critical. When you can know how much sodium is in your food, how much sugar is in your food, that helps to guide your choices. The Heart Foundation has been a big advocate against cigarette smoking, which, as we know, often starts at a very young age, teenage years, and that's critical in preventing heart disease as well. And then they had a big campaign against sugar-sweetened beverages, and we know that that taste for sugar really starts in children, and leading to childhood obesity, as I mentioned before. So that's critical as a strategy as well.
Are women more predisposed to developing cardiovascular disease than men, or is it the other way around?
Well, when it's all said and done, it's about equal. Men tend to develop heart disease earlier because women are protected by estrogen up until the time of menopause. So we tend to see an uptick in heart disease in postmenopausal women compared to premenopausal women. Although we are seeing some heart disease in premenopausal women nowadays. Wow.
And is there anything that they can, well, I suppose then we harken back to the points that you made earlier as to how to protect yourself.
Well, I will add, there are a couple other things. So sleep, we're noticing is probably an under-recognized area, where getting adequate sleep actually helps to reduce cardiovascular disease.
What about hormone replacement therapy for women?
I think the scientific evidence hasn't panned out and showed any benefit in that. In fact, sometimes hormone replacement can actually increase the risk of cardiovascular disease.
Wow. Okay. Now, our listeners want to support the work of the Heart Foundation of Jamaica. They want to recognize Heart Month, whether by volunteering, making donations, participating in events. Where exactly is the Heart Foundation of Jamaica?
Well, the Heart Foundation is on 28 Beach Road Avenue. That's off Half-a-Tree Road. What I will say, I think one of the important functions of the Heart Foundation is training people in basic life support. And I think everybody should be trained in basic life support. You never know when the person next to you is going to have a cardiac arrest. And evidence shows that when somebody is nearby to start CPR, that helps to save lives. So I think people enrolling and learning basic life support is critical in our battle against heart disease.
Indeed. Are there any final words you have, this being Heart Month, and the fact that our cool listeners want to help?
So I would say, my advice is to people to take charge of your health. Your health is your responsibility. Definitely know your numbers. So visit your doctor, know what your blood pressure is, make sure where it needs to be, know what your blood sugar is, make sure it's not elevated, know your cholesterol, get enough sleep, eat well, exercise, and keep stress low as much as possible.
Heard that? Keep stress as low as possible. I'm only repeating that because I need to do that. So I'm trying to rivet it in my mind. Dr. Wilks, thank you ever so much for being our guest on Kool 97 FM as we had another cool conversation. This time we're looking at cardiovascular disease. So, you know what you need to do? We need to make those lifestyle changes to ensure that we have a healthy heart years from now. So on behalf of Kool 97 FM, spread the word. You learned a lot today. And thanks for watching.